this book is needed for several reasons, but the main one that drove me on this book was to try and come to grips with what I call the Medicaid puzzle. Medicaid had long been viewed pessimistically in terms of its staying power in the American healthcare system. Early reformers thought that surely as we move toward universal health insurance, Medicaid would fade away. There were also a number of academic scholars who predicted that Medicaid would fade away and erode and deteriorate. And these theories were based on the notion that a program for the poor is a poor program, that it doesn't have the political muscle that, that programs like Medicare, which serve a middle-class clientele, did. There's also in theories of federalism, and I won't elaborate on all the reasons for pessimism, but a view that states are not well equipped to deal with programs for less advantaged people, that they have to cater to businesses and the affluent for fear they'll leave the state if taxes become too high, or even when in some cases that there will be a welfare magnet, that if states are too generous in their Medicaid policy, that that they will attract all sorts of people that need Medicaid and other supports, and this will create great economic pressure. So there's this pessimism about Medicaid, yet there was all sorts of anecdotal evidence that Medicaid was in fact growing and proving to be quite resilient in the face of political efforts to downsize it. And so I got interested in trying to be more specific about why it is that Medicaid endured and proved durable in the face of all this pessimism about what was likely to happen to it. So I focused in particular on the Clinton, second Bush, and Obama administrations, and sort of followed the evolution of policy through that. And I think it's a book that speaks not only to the health community, but also to political scientists and others who are interested in public policy and why it evolves in the way it does. Again, I would just reiterate that my hope is that people in the health policy community, scholars, people out there on the firing lines, would find it a useful book to get perspective on this very important pillar in the American health insurance system. But I also think that there are a lot of, the book teaches us quite a lot about American politics and policy processes, so that even for the non-health specialist, since it is the largest grant program of the federal government by far, it has a compelling message for students of political science, students of public policy, and I think students of public